So I'm really thrilled today to have wrangled Dr. Lauren Harshman for an interview. Dr. Harshman is an assistant professor at the Dana-Farber Cancer Institute, focusing on kidney cancer. And I have to tell you, if I had to put my bets on the one person that's going to cure kidney cancer within the next 30 years, I'm going to put the onus on her. I think she could do it. So Lauren, thank you so much for joining me today.
Thank you, Monty. It's a pleasure to be here.
Okay, very good. And at this meeting, Lauren, you were probably given one of the most challenging tasks of summarizing two very outstanding presentations related to PD1 inhibitors. Do you mind giving us your perspectives on that and maybe explain to us how in the clinic you might translate those findings to a patient?
Yeah. No, it was an honor. Two very exciting, actually I would say there were three very exciting studies that were presented over the last couple days evaluating nivolumab, which is an antibody to PD1, and not only as a monotherapy, but in combination with two other drugs. And so I'll break it down to say that in one of the largest studies yet evaluating nivolumab, Dr. Motzer basically detailed the results of the large phase 2 study. 168 patients had received nivolumab at 3 different doses, and overall they found that it was quite tolerable. These were patients that had anywhere from 2 to 4 prior therapies, and so the response rates were exciting in terms of it potentially being a drug that patients, in about 60% of the cases, patients had some degree of clinical benefit, whether it was some degree of significant tumor shrinkage or at the very least stabilization of their disease. I think what we need to see, and what was exciting, is that some people had this complete response. And when patients had responses, they tended to be durable, even if patients had to come off therapy. And that's really something that we don't see with our either chemotherapies or our targeted therapies in the clinic. I think what was also sort of encouraging or promising out of the phase 2 data was these overall survival results, which in the higher doses of nivolumab was close to 2 years in patients that had had 2 to 4 prior therapies. And this was sort of favorable compared to, some of our other larger studies with the targeted agents in the same setting. But I do think that we're going to need, it was a phase 2 study, only 168 patients compared to, some of these phase 3 studies that look at it in a much larger data set. And so a phase 3 study has been accrued where over 800 patients have received nivolumab, and directly comparing it to everolimus, which is an mTOR targeted therapy. And I think when we get those results, we'll really be able to say that this is a good drug, and whether it actually does improve survival. But we really do need to await those results. But I think what we've seen here today is definitely some excitement in the phase 2 results in terms of the durability of responses, the tolerability, and the promising overall survival results.